And I think that the conversation that we just had, we talked a lot about integrating behavioral health, which is a great segue into our next session. I am so pleased to introduce my friend, my colleague, my birthday twin, Dr. Dawn Tyus, Director of the NCPC's Division of Substance Use Prevention and Treatment. She will share a little bit about some of the amazing work that is happening in the division. Welcome, Dawn.
Thank you so much, Maggie, for that warm welcome. I'm Dr. Dawn Tyus, the Director of the Substance Use Prevention and Treatment Division at Morehouse School of Medicine, in the National Center for Primary Care. It is a privilege to be a part of this amazing summit and the opportunity to share some about the amazing work that my team and I are doing. Housed in this sub-department is the African American Behavioral Health Center of Excellence and the Southeast Addiction Technology Transfer Center. This makes us unique in our perspective, as we not only provide training and technical assistance for substance use disorders, but we also provide best practices to mitigate behavioral health disparities for African Americans. I have a few short slides to demonstrate our primary goals for each of our projects. The African American Behavioral Health Center. Who are we? We were funded on October the 1st, 2020 for 5 years by the Substance Abuse and Mental Health Services Administration. From its administrative and academic home in the National Center for Primary Care at Morehouse School of Medicine in Atlanta, the new Center of Excellence develop and disseminate training, technical assistance, and resources to help healthcare practitioners eliminate behavioral health disparities within this large and diverse population. Why were we funded? We were funded because of the urgent need for greater equity and effectiveness in behavioral health services for African Americans. This innovative yet deeply rooted and grounded center has been structured to mobilize the scholarship and expertise of many distinguished voices in African American behavioral health and health equity to address the following: systemic inequities that have blocked access and engagement in behavioral health services and support for African Americans. There's a scarcity of culturally appropriate evidence-based interventions and appropriate approaches for African Americans, and because of the insufficient disseminations of the resources that do exist. We were also funded because of the minimal workforce development on social determinants of health, health disparities, historical trauma, unconscious biases, and ways of building cross-cultural respect and trust. So how are we going to do this at the Center of Excellence? The Center of Excellence take a very highly collaborative public health approach toward cultural and practical transformation of behavioral health systems, working with the professional and non-professional workforce, through intervention, treatment, and recovery support practices, and through the systems of education, training, and technical assistance that prepare the field for its work. Building on the expertise of Morehouse School of Medicine, we're super excited about our goals. Our first goal is really to increase the capacity of behavioral health systems to provide outreach, engage, retain, and effectively care for Black African American people. Goal 2 is to improve dissemination of up-to-date information and culturally appropriate evidence-based principles, practices, approaches for Black and African American people. Goal 3, we want to work really hard to increase workforce development opportunities focused on implicit biases, social determinants of health, structural racism, and other factors that impede high quality care for Black African American people. And goal 4 is to increase our collaboration with SAMHSA's other Center of Excellence, as well as other entities throughout this country, to infuse culturally appropriate information on Black African American people and to have that disseminated and infused in all of SAMHSA-funded TTA centers through presentations, coordination calls, collaborative projects that engage all of the TTA providers. And our second grant, which is focused primarily on substance use disorders, is the Southeast Addiction Technology Transfer Center. This grant has been an inception at Morehouse School of Medicine for 20 years, and we're very proud to have this center housed in the National Center for Primary Care. We're one of 15 centers throughout the country. This map depicts where all of the regions are. We're in region 4, and we cover 8 of the health and human service states within the country. So we're super excited. We've grown tremendously over the years. Our mission and vision is to accelerate the adoption and implementation of evidence-based and promised addiction treatment and recovery-oriented practices, heighten the awareness, knowledge, and skills of the workforce who address the needs of people with substance use and other behavioral health challenges. We also assist in the development of a competent addiction workforce, upgrade standards of professional practice for addiction professionals in various settings. Also, a part of our mission and vision is to shape systems of care by translating and disseminating substance use treatment research into clinical practice. We also maintain an interdisciplinary consortium of healthcare professionals, educators, organizations, and state and local government representatives knowledgeable about effective science-based, culturally appropriate approaches to substance use treatment. Both of these centers align very well. 6 areas of emphasis for the Southeast Addiction Technology Transfer Center is we enhancing culturally appropriateness, develop and disseminating tools, build a better workforce, advancing knowledge adoption, ongoing assessment and improvement, and forging partnerships. Our contact information for either the African American Behavioral Health Center of Excellence or the Southeast Addiction Technology Transfer Center, we can be contacted at 404-752-1016. But also here, this is our website, and it'll take you directly to where you can find a plethora of information that we've created in regards to working with providers who provide information and treatment services for African Americans, and also the attcnetwork.org, the Southeast. But on this particular website, you'll find a plethora of information that's from all of the TTCs, the MHTTCs, which are the Mental Health Technology Transfer Centers, the Prevention Technology Transfer Centers. So if you visit both, you will be able to find culturally appropriate services as well as resources that can be disseminated throughout organizations. We're always looking for collaborative partners in both of our centers, individuals who have expertise not only in behavioral health, but working with the specific population of African Americans, but also those who have expertise and knowledge around substance use disorders. We work on a lot of projects from trainings, webinars, we put on learning communities, we provide presenters for conferences. So we do a plethora of work in this particular space. We're super excited about the work that we're doing out of the African American Behavioral Health Center of Excellence around with HBCUs, historically Black colleges and universities, to reduce stigma, change the narrative around mental health on colleges' campuses, as well as developing recovery-oriented peer support campuses throughout HBCUs. So we're excited about all of the work that we do. If you have technical assistance needs in either working with this population or around substance use disorders, please, on our website, you have an opportunity to submit a request. And then one of our coordinators will get back in touch with you to see how we can partner to bring your idea or to disseminate your information back out into the field. So I'm excited. If you have any additional questions, please feel free to reach out to the African American Behavioral Health Center of Excellence or the Southeast Addiction Technology Transfer Center at Morehouse School of Medicine. And I'm Dr. Dawn Tyus.
Thank you so much, Dawn. That was so great. Excited about the work that you all are doing, and so glad that you had the opportunity to share with the audience today. Thank you.
Thank you for having me, Megan.
Absolutely. So we are now ready to start transitioning into the concurrent breakout sessions. You will find the links to join those sessions on the event website, ncpchealthequitysummit.com. And you can choose between the 4 concurrent breakout sessions that start at 2 o'clock. They will run for 45 minutes with a short break in between, and the second ones will start at 3 o'clock. So enjoy, thank you for being here, and we look forward to seeing you back here for the closing keynote speaker.